In this video, we will be practicing what's called vooing. So vooing or Voo breathing was developed by Dr. Peter Levine. He talks about it in his book, In an Unspoken Voice. And what this breath practice does is through the sound of voo, it starts to vibrate the upper palate of the mouth. It starts to vibrate or stimulate our vagus nerve, which will help us to shift the mode of our nervous system. So this tool could be really helpful if you're in a state of freeze or checking out and you're trying to awaken the senses to move back into the moment. Or it can be helpful to move out of a state of mobilization, more of a fight-flight mode, and help to release some of that energy to move back into that state of feeling safe enough, or what's called a ventral vagal state. So I invite you to practice this with me. What it will be is we'll be creating the sound of voo, and that's like the OU part of you. And it's going to be a low foghorn sound that we'll be bringing out from the belly and the chest as deep and as low as we comfortably can. We'll make that voo sound for the whole length of the exhale. So it'll be like a voo, the whole exhale long. And then you'll pause at the end of that exhale. You'll wait for the inhale to come. You'll go with it when it comes. We'll do this about 4 or 5 rounds together total. And this is a practice that can be used at any point, even humming or oming or humming the letter M, humming a song also does vibrate and stimulates the vagus nerve in a similar way. This voo tone and how it stimulates and comes from that lower region of the body, it is most effective for this type of sounding, but you can use any type of sound that you feel most comfortable with. So I invite you to practice this with me. Take a moment to get settled and comfortable in your body. You're welcome to close your eyes. You might choose to just look down beneath you instead. I like to have a hand on the chest and a hand on the belly for this practice because you can feel that vibration moving from those regions of the body if the hands are placed there. So you're welcome to do so if it works for you. And as you start to drop into your body, we'll take a breath to sync ourselves up. So when you're ready, taking a deep breath in, take a slow breath out. We'll take an inhale to begin the practice. Exhale and more voo. And inhale when you're ready. And again. Last 2 rounds. And last round. Allowing the breath to return to its natural rhythm. Taking a moment, just noticing how you feel physically, mentally, emotionally in this moment. When you're ready, you could take a final deep breath in and a slow, smooth breath out. Releasing that practice at the end of the breath. You can start to wiggle fingers and toes. You might reach the arms up overhead. So just kind of letting any movement bring you back into the space. Knowing that this is a practice that you can return to anytime that you would like a little support. I find it's one of the subtle self-care tools that we can use in our daily life. So for more trauma-informed tips and tools, feel free to check out the other videos on my channel. And if you have any questions or feedback, I'm always open. So thanks for watching. I hope you enjoyed it.